I am Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California, and today we're going to be talking about frozen shoulder. So maybe you or someone you know has experienced this, where you can't really lift your shoulder much past horizontal. You get it here and it's either painful or it just doesn't want to move, or both. Other things that are really difficult are reaching overhead and reaching behind you to try to get into your back pocket, to try to fasten clothing behind you. Things like that are either very painful or not possible. Frozen shoulder usually affects women in their 30s to 50s, and it usually happens on the non-dominant arm. There's 3 stages to frozen shoulder. So the first is the freezing stage. The next is the frozen stage, and the last is thawing. So if you catch frozen shoulder early, sometimes you can shorten the time between the 3 phases. Without treatment, frozen shoulder usually takes between 6 months and 2 years to resolve on its own. If you've been to your primary care provider and presented with frozen shoulder, they've probably prescribed you some pain medications. They've probably told you to cut back on your activities and to rest. And those things aren't really going to resolve the frozen shoulder. They may give you some relief because you're not aggravating your shoulder. Luckily, there are some new and improved treatment methods, active release techniques being one of them, that can help shorten the amount of time that you're suffering from frozen shoulder. To better understand frozen shoulder, we can look at the technical term for it, which is adhesive capsulitis. So this basically means that there's adhesions deep in the shoulder capsule. So if you think about the shoulder, it's a ball and socket joint. The humerus, or the arm bone, it's going to sit in the shoulder cup here, and the cup being part of the shoulder blade itself. So the arm bone comes into here, and it rocks a certain way. It has motion in different planes. And surrounding all that is a shoulder capsule. It's made of a connective tissue type material, and it provides some cushioning and some support and some protection for the shoulder itself. And so it's not like a muscle, it's not like the deltoid muscle getting adhesions. It's actually a really deep structure, but there's actually protocols within the active release techniques system that allow you to address the adhesions. Furthermore, there's often adhesions in many muscles surrounding the shoulder. What will happen when the capsule gets adhesions is that the body will try to protect the shoulder, to splint the area. And so all of a sudden you have all these overworked muscles in the shoulder, the back, and the neck. So when you come into a chiropractor to get evaluated for frozen shoulder, they're going to check everything in the area, make sure that the pec minor is not too tight, make sure that the traps aren't pulling up, everything in the back of the shoulder. There's often a lot of adhesions in the rotator cuff. We really have to address all of those, and that's really going to help with this motion. I've had patients come in that can only come, with this amount of motion, and then you work on the supraspinatus and the muscle on the back of the shoulder blade, and all of a sudden they're able to get back behind their back. And that's a huge quality of life improvement. So what else? We also need to adjust the shoulder, or at least check and see if it needs to be adjusted. So there's some adjustments for the glenohumeral joint specifically. There's some more broad adjustments for the scapulothoracic joint. There's an adjustment for the the acromioclavicular joint right here, right where your collarbone comes off, there's that bump right there. There's actually a joint right there that can get out of adjustment. So there's adjusting the shoulder, and there's also adjusting the back. So a lot of times you need to clear out some subluxations in the thoracic spine before the shoulder will clear out. That's an introduction to frozen shoulder. I hope it was helpful. If you have any questions, please give us a call, 510-465-2342. or check out our website, riverstonechiropractic.com. Thank you for watching.